Nope, that's yours. Yep. Mary and I talked about if people have happy news,
right?
They actually should come up here.
Yeah.
But I'm wondering about questions that come in. So Pat's going to do her presentation.
Right.
I wonder, like, should I dial in with my phone and give people my phone to do questions? You know, like, should we have people come up here? Well, like, I guess today it's different. Like, when we have a speaker,
right,
we're not going to have them come up here to ask that question. You know, and so I was thinking maybe I should have my phone for people to ask the question so they can hear it on Zoom. I don't know. And again, it's not a big issue, except like last week, Theron went on.
Well, yeah.
Yeah.
And that was.
And so people on Zoom were you know, sending me messages like, hey, can you go to the mic?
Right. Well, we have sound and.
Yes, that's right. I just turned the volume.
Well, it's here. Let's do this. Let's check. We want to make sure we've got the right mic. Here it is. Just a second.
Okay. Okay, mic test, mic test. I turned it back up. Yeah, mic test. Okay, and Pat.
Okay, so we're not going to have a mic here? Oh, okay. I'm the model. Okay.
I added on here, when I see that today is Stu Martin's birthday. So, yeah, so.
How many reservations we have?
We had 22, but then our next two say you need it, so.
That's what I thought.
Yeah.
People would say.
Yeah. Yeah, you're right.
So we don't know how many Zoom until they Zoom.
Correct.
Good morning.
And now we have a couple of questions for you. We got a set.
Sure.
Yeah. Oh, yeah. So if you oh, okay. You're going to ask about that.
And so as the table set this way, they can't see what they're seeing. So it makes that table pretty much useless. Okay. So given the number of people we're having,
No, you're fine. This is just my sister. I can just be mean if I want
Main threats, secondary threat with these thunderstorms could be brief tornadoes, so keep an eye to the sky. Finally, a man went in for an interview for an office job. The interviewer told him he'd start at $2,000 a month, and then after 6 months, he'd be at $2,500 a month. The man applying for the job said, then I'll start in 6 months.
Thank you, Todd. Next, we're ready for our program, and Betty Bowler will be introducing our program with Pat Thompson.
Well, good afternoon, Rotarians. This is Betty out in Zoom land with a few other Rotarians that I can see on the screen. It's my pleasure today to introduce to you Pat Thompson. Pat is the director of our Marshall County Public Health Department. In that role, she's responsible for emergency preparedness and then educating all of us, the public, about that and about the infectious disease prevention and managing outbreaks. She's on a number of committees and boards and is also responsible, of course, for all of the other things that the Department of Public Health does. So with that, I would like to introduce my friend Pat Thompson to you. Please give her a Rotary welcome.
Thank you for having me today. It's a pleasure. It's the first time I presented to the Rotary, so this will be an experience for me. And it's the first time actually I presented on Zoom, so we'll see how this goes. I have a PowerPoint that I use for public health presentations, but at the end I'll allow time for talking about coronavirus if we want to. I know it's a big topic and it's not leaving us soon, so we'll get started here. So I want to tell you a little bit about myself. I was born here in Marshalltown and raised here, and it's my home, and we know Marshalltown's changed a lot through the years, but it's, you know, it's my home and I still love it just the way it is. And it's such a growing place to be too, because we have lots of opportunities for diversity and growth, and that is, you know, what I enjoy in this town. It's small enough though to really know people in town. I graduated my diploma from the School of Nursing here in Marshalltown. There used to be 2 schools at one time, and now we're down to 1. Intensive care is my background. I've been certified in critical care nursing. I don't have that certification now because I don't do that kind of work. I graduated from the University of Iowa, and I have some hours for graduate work in public health at Des Moines University. And actually, that's probably not going, I probably won't be able to finish that just because of where I am in life. But it was sure a goal for me that I really enjoyed, and I enjoyed the learning and being a part of that group. So what do? I remember a wise public health nurse answered that question quite well with, it depends on the day. And that is very true. It just, I wake up in the morning and I'm not sure what the day will bring. For sure I have a plan, but it changes, can change abruptly. I don't do public health work by myself. I have call-in staff that help me. I have 2 call-in nurses, and they help me with immunization services, disease investigation when I need it, and blood pressure clinics when I need it. And I also have interpreters, and interpreters have made a big difference in how I'm able to do public health. Without them, I can't do my job. And every time I use an interpreter, I'm always very grateful because they help me to teach and to help someone learn how to take good care of themselves. So interpreters are very special to me. the Board of Health actually determines public health activities, and I get to do the work, and that's a good thing. We have meetings, or they have meetings. I always say we, but they have meetings 6 times a year at the courthouse. I set the agenda and write the minutes, and I report on public health activities, including communicable disease activity, bioterrorism preparedness, and community health activities. I do have clinics, but you know, in this age of coronavirus, I don't have clinics set up. Someday when I have the new building, maybe I'll be able to come back and tell you all about the new building someday. I actually schedule time for people to get vaccinations or TB tests and that type of thing on an individual basis, and that works very well. This summer, I've been to 3 little kiddos' homes giving shots. You know, with the coronavirus, immunization needs do not go away. They're very, very important, and Marshall County Public Health works hard to make sure that those little kiddos and students have the shots that they need to keep healthy. And so it was fun going to, in particular, a farm and sitting on the grass in a blanket with a baby. Mom held it and I gave the shots, and it was just such a good experience, and one I'll always remember. I do give TB medications for latent TB infection. That is not a person who is infectious, but we're trying to kill the TB germ in their body, sorry about that, to keep them healthy. And then, of course, I give immunizations during my clinics, and most of the immunizations would be hepatitis B vaccination, of course, flu, and like I said, the TB test. I have done pertussis and Tdap and that type of thing in the past. And at one time, we did blood pressure clinics in the county and at the mall and the courthouse, and the latest were at the Albion Library, the Senior Citizen Center, and the VFW. They're on hold for now, but those days will come back. And during that time, I do get to take a blood pressure, of course, and educate on how to take good care of yourself with blood pressure. If your blood pressure it needs attention, if you need to go to your doctor, I educate on that. And there's other education that goes on during a blood pressure check when people just share about themselves, and I get to be a person who helps them learn about their health and how to take the best care of themselves. I really like that a lot. So we talked a little bit about immunizations already. I do a lot. I also give the shingles vaccine. When it comes down to what an immunization costs, you know, if I think you have, or if you have insurance, or there's a way that you can get your immunizations paid for with insurance, whatever the place may be, I recommend that, of course, because I don't take Medicare or Medicaid or anything like that, and I don't take insurance cards. But sometimes people have that need where they don't have insurance that covers it, so I charge for the cost of the immunization and $15 to give it. So it can be more reasonable than in an office at times, but we really encourage people to go to their doctor's office because you need your healthcare provider. There's an immunization grant that allows me to give vaccines to children 0 to 18 years of age for the Vaccines for Children's program. It's federally funded, and it's for people who are on Medicaid or no insurance, basically, is what it comes down to. And actually, public health nurses go into the schools, and we have clinics for adolescents and elementary school children, and it really fills a big gap. If we have someone new that comes into Marshall County and they need to be in school and it's hard to get into an office clear in the beginning, we want kids in school. If they qualify for the Vaccines for Children's program, then a public health nurse will go to the school and give shots just to that one little kiddo. Sometimes it's a lot of shots, but it helps out the school and the student and the parents and everything. So that's what the goal is. And we actually really enjoy doing that also. And we do some traveler vaccine consulting. I don't have all the vaccines for travelers' needs in my office because some of them actually you need to go to a traveler's clinic, which would be in Polk County or in Story County. I'm busy with a bioterrorism preparedness grant, and it keeps changing on me. Clear in the beginning, when I was a brand new public health nurse 13 years ago, I had my own county, my own money, my own decisions on how we were going to use that money within certain limits. And now we keep adding on, and we recently joined with 23 other counties, this regional, through the state. And in that group of 23, we're now called the Central Iowa Healthcare Coalition, which is, reminds me of our old hospital name. I have a little trouble with that right now, but it'll come. And during at that phase, they're doing like grant planning processes and that type of stuff. So I'll learn a lot. We'll be with Story County and Polk County and Warren County. So it's spread over a large area, Clair de Boone, Tama, Poweshiek County. So it keeps us, keeps some of our people that I've worked with in the past close together, which is a great benefit to have the partners that we know about each other. We know how to work together. We know who we are, and that helps us with our preparedness planning. And even going through the coronavirus, what do you have? What do we need? And that type of thing. And I work closely with emergency management and community partners, like I said, with Iowa Veterans Homes, Salvation Army, long-term care, businesses in town. We just try to bring people in so that we can work together to meet needs. And with the coronavirus, seeing it, as I look forward to when vaccine is available, I'll really need partnerships at that time. And public health also works very closely with our physicians' offices, and our pediatric offices, and it's a good collaborative relationship. Communicable disease, I do investigations. I receive them from the Iowa Department of Public Health, and that includes tuberculosis, not much hepatitis A, hepatitis B, enteric illnesses such as E. coli and salmonella. Pertussis, it's been a few years since I've had to do that. I do not do sexually transmitted diseases because then actually it's done at IDPH, and that's a good place to do it. And I educate. I apologize, one moment. I knew this would happen, sorry. Excuse me. Okay, so as far as TB control, I'll get a question that says, I'll get a call and say, someone has TB. Well, I basically know who has TB in the county, and nobody does. It's been a few years since we've had any TB cases, and they're very well controlled, and I'm the one that makes sure that they get the medicine to help them kill the TB germ in their body so that they can get back out in the public in the world. So it's all well planned and very well controlled, and I'm very grateful for TB control in the state of Iowa and in the United States. And I do a lot of education, and I love my patients. Excuse me. Sorry, wow. And then, so how do I do all the work I do? Well, especially with the coronavirus that we're at, a lot of telephone and Zoom meetings, that type of thing. I'm blessed to be able to work with radio stations in the county, and particularly during flu season, because they help me get information out, make TV out the college, and radio, newspaper, that type of thing. And I really appreciate the media bringing public health out there so people know that it exists. When I went into public health, I didn't even know anything. All I knew was how to spell public health, and I kid you not. So I've learned a lot. Flu clinics, prep is starting now, and they'll look different this fall, but we'll see what happens with that. And we also see children for this, well, we don't see children, but public health is responsible for the school immunization audit and various community organizations that we get to be a part of. Public health no longer has the lead grant that is done through the Iowa Department of Public Health, and that's, I actually called the number, because at this time in our lives, we call this number for this, and one day I called the number, and the person who was in charge of it answered the phone. So I know that it's happening. It's still important that lead control happens in Marshall County, and I know IDPH is working on that. And this job allows me to do what I enjoy most, taking care of people. It educates me constantly. It astounds me that public health encompasses so much, and it challenges me to grow and learn and be the best nurse that I can be. I love being a nurse. So coronavirus, I'm not sure if everybody's heard of that yet, but it's out there, as we know. And making funny there, but anyway, there's so much to learn about it yet. You know, we're clear at the beginning phases of it. We need a vaccine. That'll be our first step. We need citizens to get the vaccine. We need citizens to take it slow and continue social distancing and wearing facial coverings, please. We need people to stay home, please. And thank you. So any questions about coronavirus that you'd like to ask me about? Excuse me. Oh, I can't hear you, Betty. Betty, there.
Can you give us some numbers in Marshall County right now, where we're at, what kinds of increases, decreases, that kind of thing that we're seeing?
Okay, so what is happening really every time there's a major fun event, okay, that people want to get together like the old days, and we don't want to give up, and we totally get that because we've been, you know, doing, I think, a good job of self-isolating as far as staying home for a long time, but it's hard and we need to get out. I understand that. But when we have things like Memorial Day, Father's Day, even graduation from high school, 4th of July, there's always going to be an uptick in numbers because people are congregating, and that's what it's all about is, I'm going to say it this way, sharing your air is really what it's about. You know, that's why we ask for social distancing, because it gives us space that we're not sharing each other's air. And so, it's kind of different because one day, the last 2 weeks, say, I've had about 3 days when I've maybe had 6 to 9 new cases. Excuse me one moment, I'm sorry. I should not be allowed to talk. Anyway, I've had maybe 6 to 9 about 3 times, and the other days 1. You know, what is that? And it's just, for one thing, labs are, you know, they go to different labs, and labs turn things in at a different time. They may batch them so that they send all the notices out at once, that type of thing. So I think there's more than there were a few weeks ago, but it just, every 2 weeks, I kind of see a little bit of bump, you know, but it's not 20, it's not 30, it's not 15, you know, it's just I can see a bump. I can't tell you that age groups have changed much. In the beginning, I guess we see more people in their 20s, that type of thing, because it's because they're getting out and the weather's nice, that type of, you know, that's what's going on with that. And so what's really needs to have happen, and I think people do the best they can with it. Some people we need to try a little bit harder. We have to just be honest about it. Excuse me. That, you know, maintaining social distance is the biggie. It's just not sharing air. It's wearing a facial covering, because when I wear my mask, I'm keeping my germs to myself. And when you wear your mask, you're keeping yours to yourself, and that's safer for all of us, is what it's all about. Did that help you at all?
Yeah, thank you.
Yeah, you're welcome. Any other questions at all? It looks like you're doing now I can see the room. It looks like social distancing is happening a lot there, so that's good.
Kim, I thought I saw a message from Sue, or a question from Sue Martin. Are you seeing that on your screen?
I do not.
Kim, do you have that?
Sue, can you just unmute yourself and ask your question? Or Betty, do you have her question? You can read it.
If I can get back to it, I will see if I can. It had something to do about where, Pat, where do you get your information?
Okay.
Who reports to you? Do you get those numbers from the state? Do you get them from local sources? Sue, if you're unmuted, maybe you can ask the question yourself.
Yeah. How are those numbers compiled? Who compiles the numbers for the county that are reported in the newspaper?
Actually, those come from the Iowa Department of Public Health.
And where do they get them?
Well,
Where do they get them from?
you know, that's a very good question. I'm not positive, but it would be from, you know, from what comes into the Iowa Department of Public Health and the labs, sending in this information. So at one point, when we first started doing disease investigation for coronavirus, public health called every person that was confirmed in the beginning, and we would call them every day for a week at least. And then that changed to public health calling every 3 days. And you can imagine as numbers went up, how much of a impossibility that was, more than a burden. It was impossible to do. And so eventually it came so that Marshall County Public Health disease investigations are done by the Iowa Department of Public Health and National Guard. And they divvy them out somehow. And I'm not responsible for those at all. And so, and now they're actually showing that someone is over it after 28 days is what it is. So that you're just automatically not, and I don't think they even called to see how you're doing. In the beginning, we were thinking we were doing more nursing care in some ways, but it's really data collection is what it is. And you need to see your healthcare provider, because that's the most important thing you can do.
Thank you.
Mm-hmm.
So Pat, I have a question. This is Nancy Stevenson. Can you talk a little bit about those people that are asymptomatic? Because it's kind of hard to know. There's such a long list of potential symptoms that, you know, every time I cough and sneeze, it's like you wonder, you know, do you have something or not, yet you don't have all the other symptoms. So I guess, can you touch on which are the ones that we should be really concerned about? Because it also is allergy season. So there's a lot of stuff going on too.
So, you know, if you have some symptoms that are not usual for you, for one thing, if you're, you know, listen to me today, coughing and, you know, but it's related to allergies and that type of stuff. So anyway, if it's something that's unusual for you, then you need to call your doctor and explain what's going on. You're going to be looking too at, you know, asymptomatic would also consider, have I been in places where I potentially could have been exposed? But I have to say that anytime you leave your house, you have the potential to be exposed. So it's just a tough thing. So asymptomatic people also need to do the social distancing and that type of thing, because you know, wear your facial covering, please, because that helps protect us from people that don't know they have it. And it's all, like I keep saying again and again, it's all about sharing air. And if you can avoid that, you know, you're not passing germs back and forth.
So if you are asymptomatic, I mean, how long are you like that? I mean, do you run through a cycle like that of 28 days and then you've had it and you're not contagious anymore? Or?
Well, say it was unknown to you and you had it. Okay, so I've not been asked that question. Okay, but I would say what IDPH is doing now is considering you recovered after 28 days. So who knows when you start, right? If you're asymptomatic, you don't have an onset date, then you would, how do you count that out? So see, it's unknown. We still need to do all that stuff that, like I say over and over again, hand washing, you know, high touch areas, cleaning, all the things that we really do know to do it, is to make sure we keep doing those things, even though time goes on and we feel safe. We can't be too comfortable yet at all. In fact, I'm not comfortable. I wear my mask because, for one thing, it's actually, you know, it's my job, but also I believe in what we're supposed to do, and to help and I want to take care of you from me is why I'm doing this. I had someone say to me, well, don't judge me. And I was surprised at that, because it's not a judgment thing at all. It's about health. It's really about health, and we have to look at it that way. is think about what we're doing, getting out of ourselves. Yeah, that's not to be judgmental, but you know, we all have to be reminded to get out of ourselves every now and then, no matter what it is, and do this because I want to take care of you.
So Pat,
this is Betty. So the testing site is no longer in Marshall County. I understand it's not out at the college anymore. So if someone wants or needs to be tested, what do they do?
Okay, so it just came out just yesterday. So it's through Friday here at MCC. And it's going to be moved this weekend to, and actually went out to media. I'm pretty sure, I know I saw the 101 people that it went to. It will be at the sheriff's office. So it will be moving. And it'll be there till August, I think it was the 7th, till August 7th, I think, at the sheriff's office. You always have to make sure you go online, sign yourself up, because you'll get turned away because and you know, part of that is not that they don't want to take care of you, and it may look like there's not a line, but there's like coding, and they spend less time with you. They don't have the paperwork to take care of you at that time. You know, you have a little code number and everything goes in code. So it's to help expedite it, and also to get save some of that contact for the people that are doing the testing. Can you imagine doing testing in this weather? Oh my gosh, they've got full PPE on, and they're, you know, it would be hard. And I'm sure they're very polite and kind, but I think it's a tough place to be in this weather. So we've got to actually thank him for doing that for us in many ways.
Pat, this is Carol Hibbs at Elmwood. So
hi.
Just a quick question for you. What's the current guideline? I know self-quarantine or quarantine has been commonly 14 days, but we've had people that have been hearing different guidelines for that. Sometimes the medical office will tell them 10 days. So there seems to be some conflicting guidance, even among public health departments in the state of Iowa. So do you expect the state public health to just come out with a consistent guideline for employers and school districts to say, here's how long you stay quarantined?
Well, from what I understand, it's been consistent. Okay, they did change from, in the beginning, someone who's confirmed has the lab test to show that they have COVID-19 coronavirus. In the beginning, it was only 7 days that we monitored them, and then we could kind of see if they needed to still be isolated, okay? Now it's, if you're confirmed with coronavirus or COVID-19, you go from the date of onset, so it's 10 days or greater or more, that you're self-isolating from the date of onset, and then you haven't had a fever for 72 hours without aid of any kind of medication the last 72 hours, and your symptoms are improving. If you still continue with shortness of breath or something like that, that is not improving symptoms. Then you're considered, you can go off of self-isolation. Anybody else in your household and the contact tracings that they're doing has to be self-isolated or asked to self-isolate, please, for 14 days. That hasn't changed because we want to look at an incubation period. We want to make sure you didn't get infected by that person who has it. So that's been consistent. But going off saying, you know, because of the investigation process, and there's so many people, and trying to keep up with calling people at the end, how you doing, they've just kind of made it 28 days considering you're done if you're, you know, consider that, and they kind of drop you out. They consider you healed or whatever, improved, or what's the word in the newspaper, whatever, you know, that you're no longer infective. Okay. So yeah, whatever, yeah. I can't remember it right now, but anyway, yeah, you're recovered. Recovered's the right word, I think. So anyway, so that's been pretty consistent. There's always guidance, and it's trying to help us, help people with it. No one likes to make you do more than you have, what would be the prudent way to do this. You know, we don't want anybody having prolonged self-isolation. We don't want to do that. But we want to make sure that you're well enough and healthy enough and not infective enough to go out in the public again. And if you've had it, you still need to, because we don't know if you have any immunity at all and how strong it is, because it's really unknown. So I tell people that you don't want this again, and there are other viruses out there, so stay home as much as you can, wear a mask, wash your hands, all the things that we've been asking people to do, and social distance. Anything else, anybody? And you are always welcome to call me, because if you have, you know, I take lots and lots of phone calls from anywhere from, you know, school personnel and in the public and businesses and churches and daycares and nursing homes. You know, I take lots of phone calls, and I always like helping people figure it out. And you think, well, this should be easy, but you got to kind of sort through what the real detail is before you make a decision, the best informed decision that you can at that moment. As far as that, because people are calling because they're wondering whether they need to stay home and what they need to do for their own health and for the other health of the people around them. So I always take phone calls and always appreciate them and try to help you.
Well, we thank you very much, Pat, for being with us today, and thank you to Betty for arranging for her. And I'd like to say a special thank you to everybody that is participating by Zoom. It's great to look up there and see your names or your pictures, and makes the room feel bigger or more full. So anyway, thank you very much. I also want to thank Mark and Kim for their technological wizardry. You can tell they've been working on improving the sound system for everybody and to make an interactive system like this work. So let's give everybody a big hand. Thanks again. Okay, our program next week will be Sherry King from Unity Point Health in Marshalltown. And so we invite you to put that on your calendar and come as you are able. We'll close with the four-way test. The things we think, say, or do: first, is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned? We are adjourned.